Hello and welcome to the Healthy Families New York Basic Forms Training. The Basic Forms Training is presented in a series of webinars available to you on demand, 24 hours a day, 7 days a week. This is webinar 1 of 3. Please let your supervisor know when you complete each webinar so that they can update the MIS. I'm Corinne Noble, one of your hosts today. I'm originally from Argentina. Aprovecho esta oportunidad para decir hola. I've been working at the Center for Human Services Research since 2005, mainly on research. Recently, I made the switch to the IT department, and I hope to be in contact with you in the future, providing support and trainings and functioning as a sort of bridge between the users of the MIS and the programmers who design it.
Hello, I am John Heck. I have worked with Healthy Families for over 20 years, exclusively with the MIS, and I have a similar role to Corinne in our relationship to the programmers and the users. I also have an MSW and look forward to presenting this training to you.
The Management Information System, the MIS, has been built with feedback from the programs, people like you who contribute ideas to make it better. I hope this training will help you learn how to use it and benefit from it by making your job easier. If you haven't yet completed at least one shadowing home visit, we suggest that you stop watching and return to it once you have and once you've shadowed another FSW entering some data into the MIS. Everything we mentioned today will make more sense to you once you have had that experience. Also, before we start, make sure that you have downloaded and printed the document listed on the home page. And at various points during the webinar, you will come across a Check Your Knowledge slide. When that happens, you can pause the webinar for a few minutes and write down your answer on a piece of paper. At the end of it, you will be able to check your answers. Today's training is intended for newly hired workers, such as family assessment workers, family support workers, supervisors of FAWs and FSWs, and program managers. Please note that the new best practice standards coming out in January 2018 will introduce new names to some of the roles. The current FAW will be called a Family Resource Specialist, FRS, and the current FSW will be called a Family Support Specialist, or FSS. Because this is an online course, you can easily start and stop the presentation whenever you please. If you need to review something again, if you need to refer to other documents, if you want to review what was learned at some future date, or if you just want to get up and grab a cup of coffee. Please make sure that you visit the Healthy Families New York website at www.healthyfamiliesnewyork.org. Here you will find tons of information on the program you're now working for, the research behind it, the MIS, the newsletter called The Link, among other things. If you click on the Healthy Families New York network link on the right-hand top corner and enter the password that we provided there, you will have access to additional information and resources only available for insiders. Healthy Families New York is a part of Healthy Families America, an evidence-based home visiting model that was launched in 1992 by Prevent Child Abuse America. Research has shown the HFA model to be effective. It is a free, voluntary home visiting program that supports expectant parents. Healthy Families America and Healthy Families New York have very similar goals. They support parents by connecting them to resources available in their communities and enhance self-sufficiency. Services are designed to promote positive parent-child relationships and healthy attachments. They are based on the strengths of the family and aimed to the prevention of child abuse and neglect. As part of your new job, you will be required to collect information about the families you work with and later enter it into the MIS. As you become better trained and gain experience, you will find the best way to ask these questions and gather the information. Remember, FAWs and FSWs are the experts on what is going on with the families. The MIS relies on you to reflect the family's reality. Each HFA-NY program enters data into the MIS that securely maintains the information and provides evaluation data and descriptive reports that assist in program administration, monitoring program performance, whether or not the program is faithful to the model, and reports that help you manage your caseload, like ticklers. Data matters. Data allows Healthy Families New York to track a program's progress in meeting performance targets related to the goals of Healthy Families New York. Researchers, administrators, and practitioners work together to develop studies designed to improve program practice. We have conducted studies designed to improve early prenatal enrollment, rates of breastfeeding, and father involvement, for example. For more information about these and other studies, please see our Research to Practice portfolio on the website I just mentioned. Findings from our research have been published in fact sheets, briefs, reports, and journal articles, and you can find those there too.
So now let's start to take a look at the management information system. What you see on the screen right now is the home page, or the landing page after you log in. On the left-hand side of the page, under the Welcome, you will find various modules and webinars and training materials that will help you navigate the MIS. In the center is information about how you can get help with something that occurs in the MIS, or if you just wanted to get further clarification. And over here, we publish news and announcements. This is where if there was a bug or you had a certain request for a feature in the MIS, we would publish and let you know when it was contained in this version of the software. Also, I call your attention to this main menu bar here, and directly above that it will indicate who is logged in and what site you're logged into, as well as what your role in the MIS is. This software is a web-based, computer-generated application that each program has locally. This is how you manage your data. There are over 20 different data collection forms that are filled out by you, either on paper or online, and are reviewed by your supervisors. The various activities that you can perform within the software are that it will help you plan your home visits. It will help to monitor the quality of your data. You can display the data in various formats for analysis. It measures the fidelity to the HFA model. It also provides your program with reports to funders, accreditation peer reviewers, and agency management. It's generally designed to support program improvement activities. Information about the members of the family are gathered by program staff at timed intervals and entered into the web-based software. There are several players that are involved in your data collection. One, and the primary person, is the PC1 or primary caretaker 1. 99% of the time, this is the mother. Another player is the other biological parent, or OBP. And again, 99% of the time, this is the father. We also give you the opportunity to identify a second primary caregiver, or primary caretaker 2, PC2, when the other biological parent is not living in the home at the time of enrollment. This secondary caregiver has responsibilities for the target child, is living in the home at the time of intake or enrollment, and it usually is someone like the maternal grandmother or a new partner, or it could be an aunt even. The other players that you are collecting data on in our system include the target child, obviously, or target children if it's a multiple birth, other children that live in the home at the time of enrollment that the PC1 is responsible for, and finally, you are going to record an emergency contact person who is someone that you can contact when you are unable to locate the family. Demographics, medical events, home visits, referrals, case notes, economic and educational status, together with developmental screens and medical events for the target child, and assessment of the mom's stress levels constitute the bulk of the data collected. Each program manager oversees the information system and has the responsibility for creating a quality assurance plan to ensure the data reflect the work of their program. Various reports have been developed to assist with the process. Also, the Healthy Families New York Central Administration has responsibility for oversight and support of the program sites and have the ability to view the information in your database from a statewide perspective. As mentioned before, on the home page you see various phone numbers and links to support, and know that the support is available to you from 8 in the morning till 4 in the afternoon, Monday through Friday. We also have support with on-site training, specialized report requests, and statewide training sessions available to you. The self-paced modules that were referred to when we talked about the homepage are again available for you to get oriented to the web-based application. You'll notice there's a picture of the folks at the other end of the support line. Corey, in the upper right-hand corner, is the primary contact that you will hear, but you will also hear and get support from Jay, Rick, Ben, and Bill. Believe it or not, Corrine and I also are of help to you.
Yes. We're hoping that by the end of the 3 webinars, you will be able to recognize the importance of accurately collecting and inputting the data into the system and what forms and when they're supposed to be entered. Also, have a better understanding of the data elements and how they are used to measure outcomes and fidelity. Once the data are collected and entered correctly to MIS, reports can analyze your adherence to the BPS, the best practice standards, and the program goals. Depending on where you stand related to the target outcomes, you either congratulate yourself and continue doing what you are, or you're going to develop a new plan to correct your procedures in order to meet the targets set in the best practice standards. You then implement the plan, collect the data, and measure yourself again. This is a continuous process, which we call Continuous Quality Improvement, or CQI. CQI should have procedures that are revised weekly, monthly, quarterly, every 6 months, yearly, and ultimately every 5 years at accreditation.
The document that you hopefully have downloaded prior to this webinar has a front and a back. On the front is a chart that shows you the various forms down the left-hand column and when they are scheduled to be entered into the system. You'll notice that the various places where forms are entered are across the top. There's prior to enrollment, and those are the forms that we are going to be talking about in this webinar. Then you'll notice there are other activities you need to perform data-wise at intake. And then primarily what you see is that many of the forms are scheduled based on how old the target child is. And of course, the last piece that you need to understand is that forms are scheduled to be entered based on events that occur in the life of the family. Primarily, it would be the home visit log that, whenever you make a home visit, you would have to enter some information. On the back of that form, you will see a list of the levels and when visits are prescribed based on the model. There's some general guidelines that you should be aware of as you enter into this process. First of all, the data is confidential. It is something you should be careful whenever you have identifying information either on your screen or on a piece of paper on your desk to protect the identity of your participants. Prior to using the MIS, you should have signed a confidentiality agreement with your site that outlines various do's and don'ts of using the MIS. We suggest strongly that you only view data related to the families that you serve on your caseload. And usually in the site's confidentiality agreement, there are some consequences if that is not followed. Please do not share your ID or password with others, as this is a general rule for all websites, understanding that if something happened while someone was using your ID and password, you would be the person that would be responsible. Also, when you're not using the MIS, please close your browser. It is not wise to walk away from your computer while it is open. Also, Internet Explorer is the preferred browser to use with this, and we strongly recommend you use that. If you would like further information about the system, as we mentioned on the homepage, there are some e-learning webinars and modules that you can take a look at.
As we mentioned before, Webinar 1 will focus on the pre-enrollment period, and the forms in this category relate to the actions and activities that happen before enrollment, such as receiving information from outside referral sources, doctors' offices, hospitals, health clinics, the efforts made by you as an FAW to assess the family for needed services, all the phone calls, letters, and visits, documenting the needs of a family prior to receiving services on the parent survey, all the efforts made by the FSW to enroll the family into the program, and finally in this list we have the service referrals, but these can occur at any point during the pre-enrollment period.
So as we get back to the MIS, again, we're looking at the home page. And the first form that is entered related to a family is what's called the screen form. And the screen form essentially documents the referral from an outside agency alerting you to a potential participant. What's important here is that we make sure that the person being referred is not known to us. So what happens after you click the New Screen button is that you are asked to enter the name and the date of birth of this person that you have heard about from your referral source. What happens is that once you press the search button, the database will search for matches to what you put in. And as you can see on this screen, what matches here is the first name. If you decide that the choices there's two choices, match the person that is being looked for, you can link to that person in the database. If you look over at the end of the row, you see there's a details here. If you're not sure, you can click there and get some more information on this person named Patricia Otto. However, if these do not match, then what you will do is click here and you will create a new person in your database and fill in information on what's called the person profile. This process will then allow you to not open two different cases on one individual, because as you will find sometimes, you will get a referral from two different sources, referral sources, for the same mom and the same pregnancy. Now, what's important to also remember is that there are some required items that you need to have in order to create a new screen. So once you have entered this, either chosen an existing person or entered a new person into our system, you will be taken into the form called Screen Form. And you'll notice that the information that you have entered has been fed into this particular form. The red circles indicate items that are required in order to submit and save a screen or create a case. And they include simply the first and last name of the person being referred, the date of birth of that person, also the due date or date of birth of the target child, as you know that this is what our program's about, and also the name of the referral source. There's other information on this screen that you will also have entered. You'll notice at the top of the screen also that there are tabs, and we have two of them in this case that we're concerned about. And another thing to point out on this screen is that there are directions right on the screen about what these required fields are. So the way to get to the second tab is either to, when you're on 16 down here and hit the tab key, it will take you to that one, or you can click on the demographic criteria tab. And this is what it looks like when you get here. On this second screen are the values that determine whether this screen is positive or negative. Healthy Families New York has a two-step process. The two-step process includes having a positive screen and then a positive parent survey. We'll talk about the parent survey in a minute. On this particular form, you can see that the first three items here are all are unknown at the moment, and And down here, you can see that we've already decided that this is a teenager. So what determines a positive is any one of 17, 18, 19, or 20 being true, or, as it says down here, 17, 18, 19 are unknown. So you can have a positive screen, get by this first step in the two-step process without knowing an awful lot about the family. Once the screen is positive, then you have the option of assigning it to an FAW, and that appears down here. Only FAWs that were hired as of the date of the screen will show up in this box. Once this is complete, and you click Submit, you will have created a case. And so every screen that you put in will create a case, and then you can either, and you can continue to see this person throughout the MIS. After you create the screen, what's called the PC1 ID is created, and we'll talk more about that in a minute. Okay. Let's go on. So once this screen is completed and submitted, you will be taken back to what's called the case homepage. And the case homepage looks like this. First of all, it has tabs at the top, like we saw on the screen form. And we're only going to be concerned at this point about the one that says Forms. On that Forms tab, you will notice there are 3 columns. Our webinar is currently discussing this column. Further webinars will also key you in on the details and information and specifics of these other 2 columns. Also to note here is that there are items or forms that are enabled by the blue color, and there are ones that are not enabled, the gray color. And as you can see right now, we have 3 enabled items. We have the screen form, which we just completed, and then the next form in this hierarchical process is the pre-assessment form, and you'll notice that's enabled. And as you can also see at this point, referrals are available to you.
During today's webinar, we are going to see how all of these will become enabled as we advance in the case. So when you click on the pre-assessment link on the case homepage, a new screen will show up. For a new pre-assessment, click on the new pre-assessment button shown in the upper right. And a window will display, like shown underneath, where you will have to enter the month and year of the pre-assessment in a 2-digit month and 4-digit year format. You're going to press the tab to move the focus to Add button and press the Enter key. The pre-assessment form field will display once you do that. If you're just turning the MIS or switching from another participant's file, you will have to go back to the home page and navigate to the main menu option, Search Cases, and perform a search to find the participant. When you do that, you click on Search Cases. You will navigate to the forms where you will have to enter the PCID and search for it right now. John, would you like to explain how the PCID is created?
Sure. So generally what Corrine has mentioned is that if you're coming in after your case is created and you need to find that family again to put some more information in, you're going to click the search cases. And this little display will come up on the right here. There are several ways of searching for your case, and one of them is by putting that whole PC1 ID in there. And the PC ID is made up of the initials of the PC1, the year of birth of the PC1, a 3-digit number that represents your site, which will never change, and then the computer-generated last 6 digits, which make it unique. So that's 6 and 3 is 9, and 4 is 13. So it's a 13-character figure that you will be using over and over again to find your participant. You will also see it show up on reports and other things as a way of somewhat protecting the identity of your participant and not displaying information that is identifiable. So one way you can do that is put this 13-digit number characters in this PC1I field. An easier way, though, is to just put, say, the first 4 characters. And what that will do is 90% of the time will take you right to the person that you need. Sometimes it may be confused and show you a couple people, but then you can pick the one that you want. But another even more efficient way of finding your participants once they're in the system is to use the Select Worker option. And what you do is that you just find your name and search, and then the list of families that you have served or are serving will display, and with a link to their case homepage.
So going back to the pre-assessment form, when you clicked on it, this is what it's going to look like. A few things to keep in mind that are specific to this form. The pre-assessment form is a FAW form. On it, the family assessment worker records monthly engagement activities and outcomes for the new or expectant parents who have screened positive. It is where all of the letters, phone calls, visits you have done to try to get the family to be assessed are entered. A pre-assessment must be dated in the month of the screen or later. Prior to enrollment, the target child date of birth or due date can be changed on this form, or the parent survey or the pre-intake, as we'll see later, and not on the basic information tab. Check to see if the FAW name is in field number 3. If it's not there, check with your supervisor to verify that the FAW was hired before the form date. It is good practice to enter these forms in order from earliest to latest if there is more than one, but it is not required. The required fields, though, are the worker's name, as we mentioned before, the target child's date of birth or due date, and field number 7, the case status.
Before we get into the case status, I want you to notice also that along the left side of this screen is something you will see whenever you have any form open. And again, the idea behind this is to give you some information about the case that's always available to you. So don't forget that this information is here. You'll notice that the screen date is here, and then other dates that are important to this case are showing to you. You'll also notice that the level that this family is on is also being displayed, as well as the current worker for the family. So Corrine, what about these case statuses?
Okay, so let's say that you've been sending letters and making phone calls, but you haven't been able to assess the family just yet. If after all of your hard work, by the end of the month, you haven't been able to arrange the meeting to assess the family, you're going to enter a case status 1. Engagement efforts continue into the next month. No additional fields display. You're going to tab to the submit button and press enter to save the form. And remember, once the pre-assessment form is entered, you cannot change the status of a previous pre-assessment. Status 1 can only be completed after the month of activity has passed. Now let's discuss what happens if after all of your efforts you manage to make contact with the family, but they do not live in an area where your program serves, or the participant refuses. Then you would enter a case status 3, which is efforts terminated, engagement efforts terminated. This will ask you for a date where those efforts were terminated, and it has to be within the month of the form. And also, it will ask you for a reason in fail 8. So you're going to tab there and just choose one of the options. In the case that I mentioned, would be out of a geographical area, for example. You have no more responsibilities for this case on the MIS. Finally, let's discuss case status number 2, where the assessment is completed and the case continues. A field displays to enter the parent survey date. Parent survey date must be within the month of the pre-assessment form.
And Corrine, let's point out also that throughout the application right now, we refer to this as the KEMP. As you all know, we are moving to changing that throughout our system to parent survey. So you can, wherever you see KEMP, you can read parent survey.
Yes. We're going to decide whether it is, we're not going to decide. We're going to put in whether it's positive or negative. And you're going to select yes or no to the question, was case assigned. If assigned, click on the first letter of an FSW's last name to select from the drop-down list. You're going to press the tab to enter the date the FSW was assigned. Assignment date must be within 30 days of the parent survey date. And if the case was not assigned, a reason for termination is required.
And also understand that when you're entering this form, this pre-assessment form that says assessment completed, you have already done the interview with the family. So this is just letting the system know that you've done the assessment, and that the next step in the process would be to put that KEMP or parent survey information into the system.
Okay, so here is one of our first check your knowledge slides. We would like you to pause the webinar for a few minutes and see whether you can decide if these statements are true or false. Write your answers on a piece of paper and check at the end of the webinar.
Okay, so let's get back to the forms.
As you can see, we now have the case homepage again, and now that the pre-assessment activity form has been entered with a case status 2, the parent survey or KEMP form has been enabled in the case homepage. Also notice the red X's indicating that your supervisor still needs to review the screen form and the pre-assessment form. Once she or he does that, the red X's will turn into a green check mark.
Okay, so now that the parent survey or KEMP assessment form is enabled because of the status 2 on the pre-assessment form, you FAWs can now put this in. Understanding there's two parts to this. One is that you'll enter this MIS form with filling in information on all these tabs. Plus, when this is submitted, you will have the option of uploading the narrative component of this case. So, the parent survey form, as you know, is completed by the FAW after you have done the interview. And it identifies psychological and social risks that determine eligibility for the home visiting services. The preferred time frame to complete this assessment is during pregnancy or within 2 weeks of the target child's birth. This is a best practice standard. There are reports that you can examine how you're doing around this. However, it is also possible to administer this assessment up until the baby is 3 months old. The 3-month-old target for the target child is, again, a best practice standard. You can only enter a parent survey, as we've said, when the pre-assessment form has been completed that says case status 2. If you attempt to enter the parent survey and is not enabled on that case homepage that we looked at over here, then you might want to refer to the module Understanding Form Hierarchy, which is the e-learning module 4, which is located on the homepage of this application. You'll also notice on this first screen that the information that you have already entered on the screen has passed through to this form. We try to minimize the amount of information you need to enter into the MIS by using the computer to pass information through. The required fields for this form first are who was at the assessment, who contributed to the information that was supplied. Also on this form, you'll notice that you have the date of birth or the due date here. Again, this is a form where you can change this, especially obviously when it's a due date, it changes. That date continues to allow to be changed on the forms in the pre-enrollment period and not on the case homepage on the basic information tab. Again, we have the tabs here to describe all the different aspects of this particular form. The next area where there is a requirement, and that is the scores for the mother and the father. These are all required, and the form cannot be saved if every item is not complete. The choices, as you know, are 0, 5, 10, and U. The computer will add up the scores for you, and the scores that make this form positive are that the mother has either received 25 or above, or the father has received 25 or above. The next tabs are, after the scores, are the demographics and the history and the attitudes. But the one I want to call attention to you next is the one that says HITS Audit C or PHQ-2. These are sub-screens within this form that help you identify whether some of the challenging issues exist for this family. For these 3 particular sub-screens, you should have some training before you do your first one. The first is the HITS, which is a domestic violence sub-screen. Audit C is an alcohol abuse sub-screen, and PHQ-2 is a sub-screen for depression, or the PC1. Please note that this is the first time you will encounter the PHQ, but throughout the MIS and throughout the course of services, it is required at various points in time to do this depression screen. Later on, you will see that it is the PHQ-9 that you are administering. So let's switch over to the next tab, and that is the PC1 Issues tab. Now, the PC1 issues are current issues, meaning that once the assessment has been complete, you as the FAW are going to establish whether there's still things going on. You've talked about a lot of history in this family, but now we want to know what's going on currently, because this is going to help the FSWs determine certain activities they're going to do with the family as they receive home visiting. And of importance are some challenging issues to become aware of. And the challenging issues that are described in the best practice standards have to do with alcohol and substance abuse, depression, and as we've talked about, this is an important piece that the PHQ-9 will help us with. Mental health is also included here related to the depression. And then let's see if I can get rid of that X so we can see it. Then there is domestic violence. And then lastly, there are developmental disability and delay issues. So all these items represent what Healthy Families describes as challenging issues. And you will have to address these early on in the course of home visiting. The other thing to note is that these items also start to tell us about a performance target that we're going to measure once this family is enrolled. And the short answer to the performance target is that if any of these issues occur on this Kemp or parent survey, then when the family enrolls, the FSW has 6 months to address these issues through a referral. We will be discussing performance targets and other outcomes in a future module webinar. So where are we here? Corrine, is there anything that I've missed so far, you think, on this Kemp form?
Well, I would say, like, what about the narrative? You mentioned the narrative before, but so once you do the parent survey form, you're supposed to write the narrative and upload it into the MIS.
Right.
And if you have any difficulties on how to do that, you can refer to the instructions on the home page of the MIS for uploading and managing attachments.
Okay, so here we are again to check your knowledge. So pause this webinar for as long as you need. You might want to get up and walk around a little bit as well, or get a cup of coffee at this point. But see if you can come up with the answers to these 2 questions.
And welcome back. Take some time to notice all the enabled forms. Once the parent survey is entered, the pre-intake form becomes enabled. Also, check to see that paperclip next to the Kemp assessment form, meaning that you have successfully uploaded the narrative. Again, John mentioned it before, but if the Kemp form is not active right now, grayed out, you might want to see the understanding form hierarchy in the e-learning module 4, and you get more information there. So once you've clicked on the pre-intake activity form link that we just showed, you will need to enter a month and year in the 2-digit month and 4-year digit format, press tab to add a new add button and press the enter key, and the pre-intake form will display just as you see it on the screen.
And what you should be concerned about at this point is that if you remember back on the pre-assessment form, there was a date submitted about when the FSW was assigned. That date should determine the first pre-intake form, namely the month in which that you were assigned this case should be the first month of activity on this form.
Okay, the pre-intake form is available after a positive parent survey has been entered. The FSW uses this form to record all of the activities and attempts to enroll the parents into the program. Again, it is good practice for FSWs to read the pre-assessment and the parent survey and narrative to learn about the family they have been assigned. If the family agrees to participate, the next category of forms, the actor enrollment forms, begin to become available on the case home page. So, as John mentioned just now, the date on this pre-intake must be in the form of the parent survey or later. It is filled monthly until the parent enrolls. In the case shown here on the screen, the end of the month has come and you haven't been able to enroll the family. So you will enter a case status 1, engagement efforts continue to the next month. Status 1 can only be completed after the month of activity has passed. We have, again, just as we had in the pre-assessment, we have several fields that are required and you need to make sure that they're filled out. Field number 3, the FSW assigned. Make sure that you have your name there. Enter the due date or the target child's date of birth. And field number 7, case status, which is where we're going to choose case number, status number 1 to continue into the next month. In the case of a case status 3, this is, again, you've reached the family, they decide they're no longer interested in participating, so you would enter a case status 3 from the drop-down list on in the field 7, engagements effort terminated. You need to enter the date the efforts terminated in the enter termination date field and the reason why the termination occurred in field number 8. The participant's level then changes to pre-intake term and no further MIS requirements for this case. Now, in this screen, you see what the pre-intake activity form looks like if the parents agree to enroll in the program. In that case, you would choose a case status 2, parent enrolls, accepts services. How do we define enrollment? You're in the home, the parents agree to accept home visiting, and the consent and agreements are signed. That is the day that you're going to choose as date of enrollment/intake. If entering a case status 2, parent enrolls, accepts services, a field displays to enter that date. The date of intake must be within the month of the pre-intake form. So if the intake happens in November, the pre-intake form with a status 2 has a November date. After submitting the pre-intake form with a case status 2, parent enrolls, accepts services, that participant level will change from pre-intake to pre-intake enrolled. This is a temporary level until the identification and contact form is entered. Another chance to check your knowledge. Again, take your time.
Okay, let's talk about the last form in our pre-enrollment group. And that form is the service referral form. Service referrals are recorded on this form each time a family member is referred to a service that will be provided by another agency or another program within your agency. Services provided by your Healthy Families program are not referrals. A referral consists of either making arrangements for a participant to receive services or providing information to the participant in a discussion about specific providers so that the participant can make arrangements herself. Workers will be responsible for determining the outcome of those referrals and enter them on this form. If an FAW makes a referral and the case is assigned to an FSW without a referral outcome, the FSW is responsible for follow-up. Best practice standards say that workers should provide referrals for everyone in the household. Service referrals may be entered as soon as the screen is entered and the date and dated with the screen date or later. This is what it looks like when you have added after you have added a new referral. And you'll notice that there's instructions at the top of the page, which are very helpful to you. The components of this referral have several required items. Obviously, we need to know who the worker is, and we need to know what kind of referral it is. So in number 3, under service code, you'll notice there is if you open the pick list, a big long list. You might want to, on the home page, go to the download forms item and print the service referral form with all the codes so you can see them all at once. You'll notice on that form, if you print them, that they're categorized. So the goal for you to identify the correct service code is first pick the category that the referral falls under, and then try to choose the code that closely, that it describes what you're trying to do the closest. Under family member referred, obviously we need to know who, and you get a choice of all the family members potentially in the household. If you're making a referral, say, for a couple to go to couples counseling, you would want to make 2 referrals because you can only choose one family member at a time. As we stated, there are 2 kinds of referrals, and that is what's called the nature of referral. Arrangements are when you do all the work related to this referral for the family. The second choice is information and discussion, and as we said, this is when you talk about a particular referral source, and then the expectation is that the family or the mom or whoever is going to follow through on setting up the details of that. Referral date is also a component of the first part of the referral, the initiation of the referral, and that is when this is scheduled to happen or when you talked about this particular situation. And finally, in the first part of the referral, which is of the initiation, is that we want to know where. Where did you make this referral to, or where do you want the mom to go? You'll notice that there is an item here called Not in List, and what that does is enables you to add a referral source on the fly. We encourage you, if you're going to do this, to speak with your supervisor to make sure it follows the various patterns and logic of your list. That completes the initiation, and you can submit this form at this point. What this will do is this will put this particular referral on a report which is called Referrals Needing Follow-Up, which will help you kind of keep track of all these referrals. Because again, as we said before, best practice standards say you need to follow up on all referrals. Second part of the referral is whether the service was received. And there's a yes-no option here. If you say yes, it's going to ask when did the service start. If you say no, it will ask for a reason why they did not receive this referral. So once the referral is submitted, it will show up on the landing page here. And there are several other forms that have landing pages where there are multiple forms related to the particular form. You'll notice here that under the column Service Received, there is something indicated for the first one, but there is not anything indicated for the second two here, which means that we don't know the outcome. In order to let the system know about the outcome, what you would do is click the Edit button here and enter the two items at the end of the form, as we saw before, about whether the service is received. So we can go back to the case homepage now, and we'll notice that we have completed all of the forms in the pre-enrollment period. Notice the hierarchy, and that because we have completed the pre-intake form that says parent enrolls, we now have our first form highlighted in the after enrollment column. So this concludes our discussion of the forms, and we have one more Check Your Knowledge for you to work on. So pause the webinar and figure out what the answer to this item is.
And congratulations, you're now at the end of webinar 1. Thank you so much for spending time with us. I hope you have enjoyed the webinar and that it is helpful to you. You are now able to start webinar 2. Remember, your supervisor is responsible for verifying that you completed the 3 webinars. But before you leave, please listen to John that he'll go over the correct answers. Thank you and goodbye.
So the answers to Check Your Knowledge number 1, the first one is true. You do need to have the date of the parent survey on a pre-assessment form with the same month. In number B, an FSW does not need to be assigned within the month of the pre-assessment form, but within 30 days of the parent survey date. So the second answer would be false. For our second Check Your Knowledge questions, the answer to the first is B, prenatally or within 2 weeks of the birth of the target child. Yes, prenatally is true. Yes, in number A, and yes, in C, it is true, but the correct total answer is B. It is not the answer D, because once the child turns 3 months, they are really too old for our program. In the second item, all the items listed in A, B, C, and D are true. So E is correct, all of the above. For Check Your Knowledge number 3, the form that creates a case, as we said in the MIS, is the screen form, which is the first form in the hierarchy of forms. And finally, Check Your Knowledge number 4. We talked about on the parent survey that there were some challenging issues, and we referenced the fact that there's a performance target around if these challenging issues occur or current, and you've noted them on the Kemp assessment form, that a referral needs to be made within 6 months of intake. So the answer to this is D. Again, congratulations. This is the end of this webinar.
Goodbye.